Spasmodic dysphonia is a dystonia, or involuntary movement disorder of the larynx, where the muscles involved in speech are activated in ways that lead to a strained or strangled or sometimes a breathy voice quality during voicing, whereas the muscles behave normally during breathing and swallowing and at rest. So it's actually induced by speaking.
There are 4 basic subtypes that we typically track. One is adductor laryngeal dystonia, which is the most common. The second is tremor laryngeal dystonia. And in this subtype, patients typically have a tremulous voice quality with or without voice stoppages or breaks. The third type is abductor laryngeal dystonia, and the fourth type is a mixed laryngeal dystonia, in which the patient may have characteristics of both abductor and adductor breaks.
Adductor spasmodic dysphonia is characterized by overpressured voice. Voice is strangled and overpressured. Abductor spasmodic dysphonia is essentially a reversal of the symptoms, in which voiced sounds become unvoiced or devoiced.
It's been found that speech problems with, for example, adductor SD, or excessive inappropriate closure of the vocal cords, is provoked by words and sentences that begin with vowels.
We're ambling along a 1-mile lane running near Rainy Island Avenue.
Abductor SD is provoked by sentences or words that begin with voiceless consonants.
He saw half a shape mystically cross.
For example, an all-voiced sentence is, "We mow our lawns all year," or "Early one morning, a man and a woman were ambling along a 1-mile lane running near Rainy Island Avenue." A sentence that with voiceless consonants is, "The puppy bit the tape," or "He saw half a shape mystically cross 50 or 60 steps in front of his sister Kathy's house." We use these standardized sentences that to elicit or provoke the symptoms.
Early one morning, a man and a woman were ambling along.
We don't know why people get spasmodic dysphonia. The majority of people who are diagnosed with spasmodic dysphonia have what we call primary dystonia, or dystonia for unknown reasons. It may be that there's a familial tendency. There is evidence for genetic or inheritable forms of dystonia, and spasmodic dysphonia in some cases has a familial trend, but the majority of people who are diagnosed have no identifiable cause. There are occasional situations where an injury to the brain causes many movement disorders, of which spasmodic dysphonia may be one, and in this case it's called secondary dystonia, but most people get it for reasons we don't know.
Spasmodic dysphonia symptoms occur in a very progressive manner and reach its plateau within first 18 months of life of this disorder. And beyond 18 months, they essentially do not increase in severity. So if you had spasmodic dysphonia for approximately 2 years, I think that's exactly what you're going to have.
But there is some overlap between spasmodic dysphonia of the larynx and essential tremor involving other muscles or other parts of the body, including head tremor or neck tremor or hand tremor. There are also instances of overlap with other focal dystonias, such as limb dystonia involving the hand muscles or forearm muscles, and facial dystonias such as blepharospasm, which involves the eye blinking muscles. However, it's less than 20% of people with spasmodic dysphonia who have other dystonias, and once the symptoms of spasmodic dysphonia reach a steady state, they typically plateau. They continue on most often indefinitely, so once they occur, they don't typically disappear, but at the same time, they don't tend to get progressively worse with time, and they aren't a guarantee that an individual is going to go on to develop other neurologic disorders.